Good afternoon, Body Balance family. This is Dr. Nathan over at Body Balance, obviously. And so what we're going to talk about a little bit more today is to build off of the discussion that we had on Monday about maybe why we should think about are we or should we be icing after an injury? So if you missed that, go ahead and head over to our Facebook page. We actually have it recorded, so you can go back and watch it. And so you can obviously listen to this and then go back and kind of reference that, and kind of try to understand about a little bit more about the icing process and the rehabilitation process, and about what our ultimate goal is, and that is to prevent further tissue loss or damage, and to improve the strength so that we can get you back to doing what we want you to be able to do and what you want to be able to do, and not have that issue ever again. And so that was one thing that we talked about in our discussion, was that they've done numerous studies where they've actually had the patients, whether it be the military model that we looked at, where people would go and they would roll their ankle or sprain their ankle, and then they would get put into the protocol in which they didn't even have to do any icing or ibuprofen, and they effectively basically just told them to walk it off, and they saw a significant reduction in reoccurrence of that injury. And just like we talked about in our discussion as well, is that when we use ice, or when we use any sort of modes to help passively reduce swelling from happening, or inflammation from happening, we're actually kind of setting ourselves back from an injury standpoint. Is that we're not allowing our body's innate ability to heal itself to do it. We're kind of, like we talked about, we're setting up this roadblock to prevent us from getting to the actual accident, which is not going to help traffic any, especially if you look out on I-35, anywhere from the border all the way down to, or the Oklahoma and Texas border all the way down to, past San Antonio. There's always traffic. There's always an accident. And so you can see, like, it's hard for us to even drive through there. You can imagine the emergency vehicles. So think about that in the same aspect as, those white blood cells and all the other, hormones that are traveling to the body to get to that injured site, to help restart and jumpstart that regeneration and that healing process. Is that if we take some sort of a passive measure, such as, icing or compression, just to help get rid of the swelling because we think the swelling is bad, that we're really missing the boat with that. And so, again, it's not to say that we want this huge accumulation of swelling, because we really don't necessarily want a lot of it, but it's not bad. And so really what the swelling is that's just our body not being able to keep up with moving that back in through the lymphatic system. And so again, we talked about that all in our previous discussion on Monday, but that accumulation of swelling is just that lymphatic system is not able to help get all that fluid out of there, so it starts to accumulate. And like we talked about, is that movement is the best way to kind of help out our passive lymphatic system. So, let's just say that I was out playing baseball over the weekend, and all of a sudden I came home the next day and my elbow was just really swollen. It was really hard to move. It hurt. I could see that, maybe it was bruised, maybe it was black or blue. Obviously if you have an injury, the number one thing is you want to go get it checked out. The last thing we want to do is just kind of wait and see, and hopefully it'll get better, because, maybe the tissues might heal because our body is really good at healing, but we're also going to keep up with those compensation patterns that we had done to try to help to keep it, or to help to get it to heal, and to help to get it to not hurt as bad. So let's just say there's nothing wrong with it, and all of a sudden I've just got a lot of swelling into here. So most people, what are they going to want to do? They want to go reach for, this ice bag right here, and then we're going to wrap it up around their arm, and they're going to want to hold it there, and then once it's wrapped, it's going to be really hard to move because it's on there tight. They just want to let it relax. And so that's one route that you can go about it, and I would say that's the wrong way. I would say what we need to think about doing is that, yeah, my elbow is starting to hurt. Well, first of all, we need to figure out why it was hurting, and that's what we're here to help with over at Body Balance. We want to help you figure out, maybe your throwing mechanics were wrong, or maybe you just completely hadn't, been working out enough to the point where that whole weekend of softball tournament or baseball that you had ended up doing too much to your elbow, that maybe it's something more to your shoulder that's giving you an issue and not necessarily your elbow at all. It's just kind of matriculating into your elbow. So instead of reaching for the ice bag, what am I going to do? Because most of the time in the morning is when it's going to be the most swollen, the most stiff, because you just spent hopefully 7 or 8 hours sleeping and not moving that. So there really isn't good muscle contraction. There isn't good mobility to help move all that fluid to where those lymphatic vessels sit to help drag that back into the venous system. So what we want to be looking at doing is maybe just getting up, and the first thing that we're doing is we can help it move around. We want to figure out what we call a pain-free range of motion. And so all that is just what can I do? What range of motion? Maybe that's just right here, right now, that doesn't hurt. What I'm doing is I'm starting to stretch some of the muscles. I'm getting my biceps to stretch over there and contract over it. On the backside, I'm getting my triceps to flex and extend over there. I'm also getting some of these common extensor and common flexor tendons. They're all starting to work. But then we also can kind of work some of the adjacent tissues. So I'm working my wrist, and it's kind of starting to work in this same area. And so as I'm doing that, I'm stretching and I'm contracting, relaxing, and helping to push some of that fluid out. And more than likely, what's going to happen with that is as we're starting to feel good with that, we're going to start to open up that pain-free range of motion. So maybe initially, as I was doing it, this is all I could do to help get my range of motion, or I could only go this far with my wrist. As I start doing that more, I'm going to realize, well, hey, that actually doesn't feel too bad, and I can actually move a little bit further. And when that's the case, that's what we want to do. We want to try to get through that full range of motion again, because that's where we're getting the maximal amount of stretch and the maximal amount of contraction through some of those muscles, which is in turn going to help to move some of that fluid back into the venous system. Now, when we get rid of that fluid, we're going to help a lot of other things as well. As like we talked about, is that buildup of fluid is just our body getting behind on being able to move some of that fluid out. And so if it's getting behind, it's also not letting more tissue and more fluid come into the tissue, which is carrying nutrition. It's going to help get rid of some of the waste out of that tissue. So the more that we're actually moving, we're actually helping new nutrition get to the muscles, and that's also going to include our cells that are there to either get up and eat up some of the damaged tissue, or help to lay down new tissue so it can move from that inflammation phase into that repair phase, and then eventually we can get into that remodeling phase where we're kind of trying to help build up and rebuild some of that already strong and healthy tissue to help allow it to withstand whatever we're going to be giving to it. So, so also once we get rid of that fluid, if we get an excess amount of fluid, that's going to just start to create a lot of pressure, because there's not a lot of places that it can go. And so we obviously, our body doesn't expand a whole ton per se. I mean, we do get it when we're swelling, but when we're getting that expansion, we're actually creating a lot of pressure within that area. And that pressure kind of pushes up on those nerves, and it doesn't allow them to fire as well as they'd want to. And it's what we call inhibits some of those nerves from sending signals to the muscles to be able to fire. And so when they're not working, their muscles either getting stronger or weaker. There's very little time where it's staying put. It's kind of like complacency. You're either getting better or you're getting worse. You're not necessarily staying the same. So the same thing with muscle, and that's why as we exercise, we're helping to maintain and build some. But if we don't, we're going to start to lose some of that strength. And so if we can get to moving, we're going to help to reduce some of that disuse atrophy and allow us to probably recover a little bit quicker, because now we're not going to have to build back some of that strength that we had already lost. And now it's, kind of just starting to get back and getting everything to coordinate the way that we want it to get us to be able to do what we want to do. So, so as we kind of talk about these things, we start to see that, maybe the whole resting portion was wrong, and maybe the compression to not allow any fluid to get to the area was wrong, and maybe the icing, which was reducing some of that fluid's ability to get to the area, is wrong, and that maybe the walk it off kind of mantra is more of a better idea. And now when we say, to not rest, that doesn't necessarily mean to go to that full intensity that you were doing when you had injured yourself or something that created all that swelling, but it means to kind of do it in a limited or a modified fashion. So if I was, let's just kind of go back into my elbow. If I were to have injured that and it really hurt to throw, but I could do other things like maybe dribbling a basketball or something like that, that's completely fine. I'm working on this bending and extending, but I'm not trying to throw as hard as I can. It's a much more controlled motion. Or I can go ahead and I can grab some dumbbells, and maybe before I was doing 25 or 30 pounds, but it hurts when I do that. But if I come in and I just do like a 5 or a 10 pounder, that's, for one, it's going to keep those muscles working, and it's going to help me to prevent getting some of that disuse atrophy, but also I'm still working on my range of motion. So when we talk about not necessarily resting, we don't also want to go on to the opposite end of the spectrum and do too much, because we do ultimately want to give it a good environment to heal, but we're not giving it a good environment to heal if we're kind of reaching up to that point where we injured before, because our body obviously, for some reason or another, wasn't able to take on the stress that we were putting on it. So, but yeah, so kind of to wrap things up, I mean, like, moving is definitely what we want to do. Trying to help move some of that tissue through there. We want to keep that traffic going so we can get all those helper cells to get there, whether it's our white blood cells or some of our macrophages, some of our myofibrils and things like that, to be able to help improve that area so that we can start to transition it from, an injured tissue back to a healthy and living tissue. And rest and ice and compression really aren't, they're kind of counterintuitive when you think of it. And so what we're going to advocate for here is active recovery, that we're not, our main goal isn't to tell you to go sit down for 2 weeks and get you to feeling better. We want to keep you doing the things that we want to do. We want you to be active, because we also understand that, a lot of times there's a lot of team sports involved in it, and a lot of times once you're injured, you don't really feel part of a team anymore because you are told to go and rest, and don't need to be at practice and things like that. And so we want you to move. We want to try to figure out what level of movement that you can do at that point in time when you come to see us, or where you're at in your rehabilitation process, that you're going to be able to prevent any more loss of strength or healthy tissue, and try to promote that healing to the point where you can get back to where you want to be quicker without any issues. And so I guess the last thing I'll say is that if you have any injuries at all, you should definitely go get them looked at first. I mean, we don't, a lot of people are going to sit there and say like, oh, I'll just walk it off, which we want you to, but we start to build these compensation strategies to get the movements that we want. And then when we heal, we don't revert back to doing it probably the biomechanically sound way or the more efficient way. We keep staying and doing it the way that we learned how to compensate, because we never really had a reason to change back out of that until we probably compensate too much that we're actually having another injury that we have to deal with. So if you do have an injury, come in and see us. We can give you a good evaluation and figure out what exactly is going on and what we need to do to help get you back to where you want to be. So there's plenty of ways to follow along with us. You can follow us on Facebook. You can go ahead and jump onto our website. We're constantly doing new webinars and free things that we want to help empower our patients and our population of people that follow us and kind of depend on us to help them achieve what they want to be doing. We want to try to get out as much free information for you guys as possible so you can make the best decision for yourself. I mean, that's ultimately what our goal is to be good vehicles of information so that you can figure out what's going to be the best thing for you going forward. So appreciate your guys' time. Hopefully you guys learned a little bit, or maybe just had a different way of thinking about your injuries. And until then, this is Dr. Nathan from Body Balance Physical Therapy.